Hi, my name is Tyler Girman. Today I will be presenting When Words Become Medicine. It is an interdisciplinary examination of how medical language can shape patients' behavior and patient adherence. This project draws from three of my minors: molecular medicine, biology, and then medical health humanities studies. Show that communication between doctors and physicians is not just sort of an informational way to convey things. It actually affects the patient's adherence and our biological workings. And this is for Dr. Stojanovich's MDS 489 class. So the purpose of the project is to really explore how medical language from the physician to the patient can impact very heavily, not only biologically, but also emotionally. So the patient will have certain hormones that will circulate when different physiological responses to different stimuli. I'm going to highlight interdisciplinary insights from molecular medicine, biology, and humanities. So I tried to split molecular medicine and biology the best I could by kind of keying into different studies for each. And the humanities more focuses on how medical language can shape a patient's understanding and how they will adhere to later treatment better. So overall, the purpose of the project is just that not a single discipline can explain this issue alone. So taking these multiple minors that I have and looking through different lenses to build a more complete picture of a problem that many patients and physician relationship face around the world. So negative communication really will activate the stress pathway. So that's like kind of what I hinted on before, is that in the molecular medicine type of lens, it's that verbal cues can change the hormones we experience through neuroendocrine systems and our different responses through like immune type systems. So sometimes physicians can give threatening language, which is really awful for the patient and physician relationship, which will elevate cortisol, increasing stress, and this even influences all the way down to gene expression. It also shows that patients can even struggle with some molecular testing terminology, which I discovered in writing my paper. So a lot of times patients will have to deal with something called medical jargon, which doctors sometimes don't even realize they're doing it. Sadly, if they do, they should stop doing it. Is some patients don't understand all the medical language that doctors may use, and even as we are studying West Virginia University, West Virginia has one of the lowest health literacy ratings in the United States, which is very sad. So it is very important to kind of understand where your patient is coming from and use understandable words to get your point across without making it too confusing for them to make sure they can follow up in the correct way. So patients having to understand challenges. So even different doctors can use different terms, and this can, for a more complicated problem, a patient may need to see multiple specialists and physicians. This could cause a great misinterpretation and fear among patients because they might not know which doctor to follow, might not even understand the directions because there's so many different ways. And the terminology difference between clinicians leads to a ton of inconsistency. But clear communication and even physician-physician communication to help the patient supports autonomy and allows them to make their own choices in their health. So, biological stress pathways. Basically, biology more shows what happens in the body, and that language definitely triggers stress. We could see, due to the cortisol and other stress hormones, a heart rate increase, our immune functions and pain sensitivity can all change. That sympathetic nervous system also leads to all that. And even the smallest cues can trigger large physiological responses that cause big problems for humans. So placebo and nocebo effects is when doctors will either tell patients they're getting something, or a nocebo is they're not getting anything at all to see if they see the same effect. So these expectations, which was actually really interesting to see in the biology aspect, they could influence pain, mood, and bodily symptoms to a great ability, causing major physiological changes, even though the patient may not even be completely affected by it. They may not even realize it. So these words can actually induce many medical issues like headaches, nausea, or even better, for relief without any treatment at all. So emotion-related brain activity predicts placebo analgesia, which is like the relief from pain. So meaning making in medical encounters. So it is very important to make these medical encounters worth it for the patients, because some of them, at least in rural areas, have to travel very far. So it's important that they understand it at that time being. So sometimes I see it helps, even in my own position working at the hospital, that patients like to use analogies to understand certain things. So getting to know the patients better and understanding what they like helps you kind of shape different metaphors to get across to them the point you need to make. And language can shape many different emotions here. And usually it is kind of awful if you use technical definitions, because they'll try to focus on that, believing that's what's most important. So it's more important to connect with the patient on an emotional level than the technical level. So from the humanities perspective, we kind of see that different terminology carries ethical and cultural implications. So this means that it depends patient to patient how a patient will feel when certain language is used around them. And it is even noticed that stigmatizing language in their medical charts that they can now see on certain apps, like the WMI chart, that could impact future care. The patient may not want to come back and visit with the physician because of maybe some negative language that may have been used. But it is best to see that patient adherence does improve when communication is overall empathetic and positive towards the patient, no matter what the result is. So communication failures in healthcare is very sad, because it definitely negatively affects patient adherence and how most medical situations turn out. So poor communication increases non-adherence by 19%, which is such a large margin. It is so scary. And chart language can, again, signal this disbelief or bias and cause this non-adherence. And the terminology physicians use definitely influence trust or care continuity. So, as I said earlier, this care continuity, many patients may not want to come back to the doctor, and even not maybe want to see a different doctor in the future because of a negative experience with a physician beforehand. So as we like to combine our different disciplines here to give an interdisciplinary lens on this issue, there are definitely tensions, because biology focuses more on our mechanisms and molecular medicine the same way, but humanities focus more on our meaning. Molecular medicine studies controlled environments, but not real interactions. So it's hard to see because of bodily functions, but we don't get what's actually happening in the physician and patient conversation. So we need to integrate all of these in a very important and efficient way. So as a unified framework, words trigger meaning and emotional interpretation. The meaning can activate stress pathways or even reduce them, hopefully. And so we see this shape and change our outcomes, and it even continues across future medical cycles. So for clinical practice, communication should be treated as a medical tool, not just conversation, because it is important of the different pathways that it does release. Terminology guidelines could reduce patient stress. There's also different tests that allow patients to take beforehand, so doctors can administer their health literacy and know how to speak to them effectively. So in the future, it would be nice to see for research to test how reframing different diagnoses affect different biomarkers. So this kind of incorporates this molecular medicine conversations of how different things, how different patients react to different kind of conversations, and we could track biomarkers using biology aspect. Studying stress reduction through communication training would also be very important. And as AI develops, it is used in more and more issues, and developing tools to detect stigmatizing language could actually remove it from chart notes and allow the physician to kind of realize that they are making mistakes like that without even having to proofread. Of course, they'll fix it afterwards. So, overall, with our interdisciplinary process, I initially relied heavy on biomedical assumptions. Being a chemistry major, that was just what was I was very prone to. But as I've taken more of my humanities classes, I've expanded my narrative of how important it is for communication between patients and physicians, especially in my health communication class through the multidisciplinary major, which was very helpful to me. And integrating all these created a more complete model of language and health that I plan to carry on with me as a hopeful future medical student. So overall, medical language shapes physiology, perception, and behavior. Our interdisciplinary insights. So as I've been able to see, provided the clearest understanding to this issue that I have seen so far, I have been able to combine many things and kind of overall understand how I should be able to communicate with patients, and that improving communication can directly improve health outcomes. So overall, I just want to give advice to doctors everywhere. Just make sure you're using good communication, and it will be the best for your patients. And here are my works cited, and I hope you enjoy my talk. Please reach out if you have any questions. Have a great day.